Okay, so in this video, we're going to talk about deciding whether you want an epidural or you want a natural birth. Okay, so there are a few things. The first thing I want to, it's just a full disclaimer, I am neither pro epidural or against it. It's almost as if you have to really just know yourself and know your threshold of pain, whether you have a high tolerance or a low tolerance, because it's painful. Okay, so natural births are painful, but they're faster. They don't take as long because you go by your natural rhythm, your body's natural rhythm. So whenever baby's ready to come out, your water breaks, you start going into active labor, the contractions start coming, they get stronger and stronger, but you're able to feel it, so you're able to know exactly when you want to start pushing, etc. And that's natural birth, right? So natural birth does, it is the safer way to give birth. It's the natural way, right? So a lot of women have been doing it for many years without epidural. And they have been fine. But again, if you're someone whose tolerance for pain is very low, okay, or low enough, epidural would be something that I would suggest. So I would suggest getting an epidural. If that's something that you feel you would make your birth, the birth of your child, better, easier, more manageable, less painful, obviously, then yes, I would suggest epidural would be something that you would want to do. Obviously, you want to weigh out the pros and cons of everything. Make sure that you're knowledgeable as to what an epidural is, what it does, how it works, the different kinds of epidurals. Because obviously natural is natural, right? You feel everything from start to finish. Although, like I said before, it is a lot faster. It's a lot faster process. So, yeah. So let's get started. So epidural. We're going to talk about epidural right now. Epidurals are common. It's a common procedure for pain relief or a lack of feeling for labor and childbirth. An epidural is generally safe. An epidural is generally a safe procedure, but there are some risks possible and side effects possible, right? So an epidural is a procedure that involves injecting a medication. An epidural is an injection, is a medication that requires an injection into your lower back. It goes in a thick needle, and then a catheter, like a small tube-like catheter, goes through that needle and into your spine, and it blocks out the pain signals from going from your spinal cord to your brain, which blocks out the pain, right? So they either use an anesthetic or a steroid. There's two things, right? So an anesthesiologist or a certified RN anesthetist will do the procedure. An epidural with catheter or combined spinal epidural combination of two injections, it's a spinal block and an epidural. Those are the two different common ones, right? So they're also known, the latter is known as a CSE. Okay, and it's also known as the walking epidural. So the CSE is known as the walking epidural, and then the epidural with the catheter is the one where you're kind of stuck to the bed during the birthing process. So you may feel pressure, tingling when they're doing the when they're giving you the epidural. Okay, you may get like a burning feeling sensation for a little while they're inserting, and a shooting pain, but after that, you don't really feel much at all. They give you a little button. Don't mind my makeup on my hand, sorry. They give you a little button to push whenever you start feeling pain, and it kind of shoots and injects the pain medication or the pain blocker, I should say, into your lower back. The pros of an epidural are usually very effective, generally very safe. You can often still move around in your bed. If you're experiencing a very long laboring process, the epidural gives you time to kind of sleep because you don't feel the pain as much, so you can rest. You can usually get it at any time during your stay at the hospital while you're in labor. And they're also during C-section so that you can stay awake but still not feel anything from your waist down, right? Okay, so here are some risks. Although they are rare, okay, I don't want to scare anybody away from something that they feel they may need for their laboring process. Having low blood pressure is a problem, which can make you feel lightheaded when they're doing the actual injection. So experiencing a severe headache caused by spinal fluid leakage, less than 1%. Okay, less than 1% of women experience that. Getting an infection from the epidural, having a negative reaction to the medication, experiencing bleeding if a blood vessel is accidentally ruptured during the insertion process, having damage to the nerves and the injection site, and temporarily losing control of your bladder. So when you get an epidural, you also get a catheter into your bladder, so to empty your bladder out. So if you have to pee, you can pee, because they'll insert that so that you can release, right? So those are the pros and cons, the advantages and disadvantages. Okay, some more advantages are usually provides effective continuous pain relief, may allow you to rest, right? Like we talked about. Maybe turned up or down, okay, to provide some sensations which can help with the more effective pushing. So like I said, you can kind of control how much goes into your back, depending on how much you want to feel. Okay, so like I said, natural birth is normally faster because you can feel, you know, when you need to push, and it's just more effective for a quick, not easy, okay, but a quick delivery. But of course, again, if your tolerance for pain is very low, okay, I suggest you weigh out your pros and cons of the epidural and just make the most educational decision that you can. Some disadvantages, the epidural takes time to take effect, so it's going to be a little time before you start actually feeling nothing. Loss of mobility, so you can't really walk around, but you can do different positions in the bed. We can work with you being in the bed and having an epidural if that's something that you want to do. Obviously, you want to make sure that you're comfortable above anything else, because you are priority. It can cause your blood pressure to drop, so you'll probably be cold, get a little shaky, which can affect also the baby's heart rate. So that's why it's, when you have an epidural, the fetal monitor is so important. Okay, it does require IV, a catheter, continuous monitoring, and little or no food or drink. Okay, also after you have to be able to use the bathroom on your own and walk around and have a bowel movement by yourself too before they release you, I believe. And then, like I said before, may lengthen labor and or increase the need for Pitocin. So if you want to do unmedicated, I think it's amazing. I think that all women have that power and innately in them to do that. Women have been doing it for centuries, unmedicated. But of course now with medicine and just those interventions, I know it wasn't easy doing it naturally. So like I said before, I'm neither against or for either of them. I am for my clients and whatever decision it is that they need to make for themselves. I will support that decision as long as it goes with their birth plan and what they envision their birthing experience to be, right? So as long as they're healthy and safe and everything's safe for them and baby, then by all means make the decision you feel that's necessary for you. So that's kind of like my spiel on natural versus epidural. So yeah, I hope you enjoyed this video, and I hope it was informative, and I hope that you make the best decision for you.